Dr. Leonhardt, welcome back to Fempower Health. It's been a couple of years since we've spoken live. I know
And you as well, Georgie. And thank you for having me.
you've written your second book. The other one was on POI and early menopause. And this one, for anyone who's on video, it's what every woman needs to know about her skin and hair and how the hormones on your inside affect you on the outside. So before we dive in, why don't you give us your background and tell us also why you wrote this book?
Thank you, Georgie. So I'm originally from Germany. I studied medicine there, and then I moved to the UK, and I worked as a junior doctor there, and I've eventually trained as a general practitioner, which would be a family doctor in the US and Canada, I think. So I'm a family doctor or a GP, and then I also have a specialty training in menopause. So I'm a menopause specialist. And I focus a lot on women's health in my day-to-day practice as a doctor. And as to why I've written the book, so in my first book that I co-wrote with Dr. Hannah Short, which covers early menopause and premature ovarian insufficiency head to toe, I was writing the chapter or the section on skin, how menopause and our hormones affect our skin and hair, because, you might feel completely depleted and you might have lots of physical symptoms that you struggle with, and then you also look in the mirror and you also have dry skin, itchy skin, and hair thinning, and you're wondering, is this related to the menopause or to hormones as well? And I get this question from women all the time. So while I wrote this little section, I thought, oh my God, there's so much research here, so much information about how hormones in general, so estrogen, progesterone, testosterone, but all other hormones, cortisol, thyroid hormones, melatonin, how they have an impact on the way we look. So they have an impact on the way we feel, but also on our skin. And the skin is, in its own right, is a hormone producing gland as well. So I went down into a rabbit hole basically, and I thought, and then I had accumulated so much research, I thought I need to put this in a book because surely I can't be the only person interested in this.
Oh, absolutely. And this is such an important topic to be covering now because menopause is having its moment, as many have said recently. Documentary was published here in the US. It came out on World Menopause Day. And we know that half of the world's population will reach menopause. Given that we are also higher income earners, it's ripe for investment and products. And so, tell me more about like the evidence-based approach that you took in this book and kind of your overall philosophy.
Yes, so I'm a doctor, but I'm not a dermatologist. I have to point this out. So I do treat skin condition in day-to-day practice, but they're very simple, straightforward, easily recognizable skin conditions like eczema, psoriasis, acne. We do treat them as in the first instance because we also gatekeepers here for secondary care. So not patients, when they get free healthcare, cannot just go and turn up at the dermatologist's office to ask, what is this? So we start treating them. If we don't manage it, we can refer them to dermatologists. So I know about skin, but I had to look at the recent research and what has come out in skin research and how our skin and hair functions. And there are a few new things that I stumbled across. For example, the brain-skin connection, so that the brain directly communicates with the skin. This is a really new area of research, that there are messenger molecules and precursor hormones that directly communicate with our skin. We have a new area which is called psychodermatology, which looks at how stress and emotional well-being impacts the way skin diseases and our skin health. And then we have also the two big areas of microbiome. So this is the skin, the bacteria and the microbiota that live on our skin synergistically. And if things go wrong, if the wrong bugs live on our skin, they can cause damage and harm, but also the gut-skin connection. So these are all new. So I read a lot of papers about that. I understood how the skin works in its very minute intricacies, and also that we now more and more understand that the skin in its own right communicates via hormones, produces hormones. The skin is basically capable of making its own hormones, very small quantities. We can't really measure them, but it makes its own cortisol. It responds to stress hormones from the brain directly. It also makes estrogen. It responds to estrogen. And so I wanted to understand how does the skin interact with hormones, and how does it work as an organ in its own right. And it is super fascinating. So I did lay out how the skin works to understand it in the concept of hormones in the book. and explains this a little bit, and also how our skin changes throughout the female life cycle. So women, we change a lot. We have to be very we have to adapt to so many things. There's puberty, then there's our reproductive years when our hormones change on a monthly basis, almost from day to day. So we have to be very flexible. We have to constantly adapt to changing hormones, as you know. Then we have the perimenopause, another change. And in between, we have pregnancies, if we're lucky and that's what we want, we have to change again. Our body has to adapt. And then we've got the perimenopause and the menopause. And our skin is not really the same. Collagen changes, hormones change, the skin thickness changes, symptoms can get worse, skin conditions can get worse. Sometimes they can also get better throughout our female life cycle. So I did look at a lot of the research, and I wanted to condense it into this book to help women navigate each section of their life cycle wherever they are, and lay out some simple treatments and when to seek help, and to also realize that a lot of the things we experience is normal, but they can be distressing. So what's normal doesn't necessarily mean it's also pleasant, So, and I wanted to give women hope that there is something they can do about changing hormones and changing skin symptoms.
Yep. No, absolutely. And the book definitely does that. And what I love is some of the some of the research that you shared shows that there's really some very inexpensive, simple skincare routines and lifestyle routines that we can do to look our best. And I think when we spoke earlier, you had mentioned, this is not to judge someone who wants to buy fancy, expensive cream. This is really about, first do no harm. What does the data say, so that someone can make informed choices about how they take care of their body and their skin. And, especially for those who may not have the dollars to spend on the expensive skincare and whatnot, there's definitely a lot of helpful information in the book.
I mean, you, Georgie, you have been watching the menopause industry and the menopause market for a long time. So I feel that the skincare industry is very similar. It's overwhelming. There's so much. In menopause, we previously had very little options, very little information. It was sort of, oh, it's normal, it's natural, just get on with it. At least here in the UK, we've now got a really helpful awareness going through society, which is amazing. But now we almost have too much information. So women can't see the woods for the tree, the trees for woods for the tree. Sorry, you know what I mean? So it's
whatever the saying is.
Whatever the saying is. So it's just the bottom line. It is very difficult to know what is good advice that someone gives you on social media, what is evidence-based, what is safe, and what is just someone trying to sell a supplement that makes them a lot of money, and they don't really care about you as the consumer. They just want to sell you something. And skincare is similar. We do have a lot of skincare that promises you the world, and then often very expensive. Did it really justify the price tag? Marketing is very powerful, and we know that. When you see these beautiful pictures of airbrushed images on social media of women who use that particular skincare product, or they take a particular supplement for menopause, you believe at that moment, oh my God, look, if I buy this, maybe I'll feel and look like that. But often the truth is not quite like that. And I just wanted to give women some tools to see beyond that. And I don't have any problem at all if you feel that your $200 small pot of skin cream really turned your skin around and cleared all your problems, and you can afford it, then please continue taking it. I don't have a problem at all. But what I don't like is when women potentially can come to harm by buying products, financially harm, by feeling pressure to buying into things that they can't afford, but also maybe even physical harm, because a lot of these products, supplements and devices are not necessarily useful. They can actually be harmful because we don't have enough data in the long term.
Right. No, absolutely. And I think, just going back to the ingredients, I believe you mentioned that, if you look at the ingredients in the skincare creams that are marketed for menopause and the other skin creams, so to speak, really the ingredients are often quite similar, but the ones for menopause are more expensive. So tell us about that.
I really object to that, because let's say you've used a certain skin cream, a simple moisturizer that is affordable and it works, it moisturizes your skin. We never expect miracles from moisturizers. So why does that moisturizer that worked for you in your 30s suddenly stop working in your 50s? Well, it doesn't. It still works. And you may need a slightly richer moisturizer maybe when you're older and you have drier skin. So if there's certain skin concerns you want to address, you need to find the right product. So if you've got very dry skin and no acne and no oily skin, then you may want to use something slightly richer. But there are also younger people with eczema or with very dry skin, and they may use the same moisturizer without the menopause label in the same way successfully, like you could do that in your later years. So the word menopause is meaningless. It's just a marketing term. It's a complete marketing term. And saying we have menopause chocolate here in the UK, and the price is like 3 times what we normally pay for a bar of chocolate, because they claim that the polyphenols in the chocolate and the added fiber and the added linseed, whatever, helps with God knows what. But of course it doesn't. It's just chocolate. And, women are, it's quite predatory, really. And you should just, if you want to eat chocolate, then you should enjoy the chocolate for the sake of eating the chocolate and not thinking you get extra value benefits. You just eat it because it gives you pleasure. And the same with skincare. You have certain expectation. You use a cream because you've got tight, dry skin. You put your moisturizer on it. It feels for a few hours better. And that's the whole point of it. And it doesn't need that label. It can be any brand that is affordable. And on the whole, a lot of moisturizers have the baseline is the same, because we do not reinvent the wheel. And by the way, they're all chemicals. Even if they use the word natural, everything is a chemical. So again, that's a marketing term, So whatever works for you. Yeah.
So let's say that this is almost the equivalent of how we talk about marketing of food. So if you look at the front, it'll say one thing, and then you look at the ingredients, like one, and I will say this took me a long time to get over, is I eat everything full fat. I do not eat anything low fat, no fat, because what they do to make it taste good is add sugar, which is even worse.
Correct.
And so I read the back of labels now because it's so interesting. So that now we're having that with menopause. So why don't we start? Because I know we've talked about like a lot of some of these like highlights of things to consider, but why don't we break it down a little bit? Because I know so many in the Fempower Health audience love the science. So can you just talk to us about what's really happening to our bodies? That sounds like a negative statement because I don't want it to be, but what is happening, I should say, inside our bodies when we've gotten into the perimenopause and menopause phases, and how that impacts our hair, skin, and nails?
So perimenopause is a term that we use medically to describe ovaries that no longer function as effectively as before our premenopausal years. So that might be in your 20s or early 30s, when women, if we leave them to cycle freely, they would, if they're healthy and happy and everything works, they should be ovulating every month and they should be menstruating every month. And ovaries age faster than the rest of any tissue in the body, and this is designed to work to happen. We are supposed to stop reproducing, and they stop working at some point. They retire before everyone else retires. So they retire first. But in the lead up to the ovaries retiring, I just call it retiring because it sounds like a nice positive term rather than giving up or estrogen deficiency or whatever. So the ovaries retire at some point. But before that, they're in the early phase of perimenopause, which we have no set date when that happens, but some women can experience symptoms as early as their late 30s, because we know for sure that fertility, and you are an expert in that as well, Georgie, fertility declines from sort of 35 onwards, doesn't it? So if you haven't been able to get pregnant, you probably need a bit of help beyond that. Anyway, that's basically the beginning of perimenopause, of course, because ovaries become less and less efficient in ovulating. But in the early phase, we do still produce a lot of estrogen. And very early on, sometimes ovaries can go into much of an overdrive, so they can produce loads of estrogen. And that can result in very heavy periods that are very frequent. And this is typically a woman who is fed up with flooding, bleeding so heavily that you can't leave the house, cramps, adenomyosis, endometriosis flare-ups. And that woman also is at risk of low iron, so she often gets iron deficiency, and iron deficiency can very much lead to hair thinning. It's one of the most common reasons to have generalized hair thinning, which is a main concern. It can also be very stressful, and it can affect your energy levels, it can affect your sleep. And the skin responds to that, because we also not only have sometimes very high levels of estrogen, we also have severe ups and downs. It's what I would describe as an estrogen roller coaster. So in the early perimenopause, estrogen fluctuates a lot. It can be very high, it can be very low. Your periods start to become slightly irregular, maybe closer together, then further apart. And these ups and downs of estrogen very much reflect in our skin, because you have to imagine the skin, the turnaround is quite quick. Our skin cells renew every 28 days when we're young, and then every 35 days as we get older, but it's quite a fast renewal, and they have to respond to these changing hormones all the time. Then a lot of women complain about sleep problems, anxiety. Lack of sleep has huge detrimental effects on our skin. We just need one good night's sleep, and then we could wake up in the morning, look in the mirror and think, oh my God, I look great. And we wish we had that every day, because imagine how our skin would look like if we slept consistently every day. So lack of sleep can lead to overeating. So women then eat sugary things, or instead of nutrient food, dense food, they may eat calorie dense food. They gain weight. Weight gain can have an impact on our skin as well, and our hair. So this is all the perimenopause. But later on, once our periods, the ovaries are working less and less efficiently, our periods are further apart, and then we go into a more estrogen deficient state. And deficiency is not a nice word, but we have less and less estrogen at some point. And when our period stopped for a whole year over the age of 50, then we would be called menopausal, or our postmenopausal years will start from then on. And so initially we do have estrogen, but the fluctuations are causing problems with our skin and hair. And it can particularly, one of the problems that we see in perimenopause in particular is sensitive skin. So women will have maybe be using a skincare product that they've used for years, and suddenly they get very red or itchy and blotchy, or they develop autoimmune conditions related to the skin. So they can get lupus. Lupus, for example, is very driven by high estrogen levels, lupus erythematosus, which is an autoimmune skin condition. Psoriasis can get worse, eczema can get worse. I don't know if you've heard of perioral dermatitis, which is very common. That is a problem that can get worse. And later on, what we also see in terms of symptoms is adult acne. So we see, when you have, in relationship to testosterone, which remains pretty stable throughout the years, we may see a drop in estrogen overall, and then testosterone has more of a stronghold on the skin, and so we can see acne return, in particular in those kind of women over 45. They get acne lesions, spots on their chin and on their lower neck. So not so much the T-zone like we get when we're during puberty, but we get more sort of on the androgen sensitive areas in the lower face. Rosacea is another skin condition that very much doesn't like any change. When you experience particularly hot flushes and night sweats in the perimenopause, which is a sign of changing hormones as well, the blood vessels enlarge and constrict and enlarge and constrict. And the same happens in the tiny blood vessels in the face, or the capillaries. And rosacea is an inflammatory condition of blood vessels. And estrogen is an anti-inflammatory. So when estrogen fluctuates a lot, we see inflammatory skin conditions flaring up. And that can be very debilitating. So these are just some examples of potential underlying skin conditions getting worse or coming to the surface, being more noticeable. The other thing that women might notice, and this is common, more hair growth around the chin. Again, that it's driven by testosterone, and so they start plucking the chin hair or having laser treatment and so on. So these are the changes. And later on in our postmenopausal years, we are really defined by not having any estrogen or very, very little estrogen. So the perimenopause are we still have estrogen, but we are going through this wild roller coaster, these ups and downs, and testosterone is the same. Then the balance between estrogen and testosterone shifts a bit. And in the postmenopausal years, we have very low estrogen, and that's for the rest of our life, because our ovaries have retired and they're not going to make any more. So provided you're not on HRT, you go on in your postmenopausal years to have similar estrogen levels as a 9-year-old girl. Now, estrogen has very important functions in the skin. So we see different symptoms in our postmenopausal years.
Awesome. Well, thank you for sharing that. With respect to, so one other thing I did want to bring up, and I promise everyone we're going to get to lots of wonderful solutions because there is lots of hope. And that is with respect to skin. I think a lot of us may think our face, on our arms, on our legs, but we also need to talk about in our vagina and our vulva. So talk to us about the skin in that area so that people can understand, because this is the one I don't think people are talking about enough. And this is an area that is especially important to be proactive about. I know I tell all my friends, please ask your doctor about this. Please ask your doctor. So talk to us about
Yeah.
what the term genitourinary syndrome of menopause.
Thank you. Yeah, so this is really important. And I always tell women, look, you look after your face because it's important to you. You put your sun cream on. We need to look after our vulvas and vaginas in the same way as we look after our face. We mustn't, it's the same skin, and it's actually very fragile. It's very thin, and it's incredibly important to keep it plump, to keep it hydrated, to stop it from becoming fragile so it doesn't break. So this is a problem that arises very much as a result of having not enough estrogen, so a lack of estrogen over time. And estrogen, we have estrogen receptors in all of our cells, in every single cell of our body, but we have a lot of estrogen receptors in the genitourinary area. So we can use very successfully products that we apply topically to the genitourinary. We have creams, we have gels, we have a ring that we can insert. If we don't have estrogen over time, I think 80% of women will develop symptom related to the genitourinary syndrome of the menopause. It's now a whole spectrum of symptoms, ranging from irritation, vaginal and vulval irritation, to itchiness, to thrush, severe debilitating pain during intercourse, not being able to have penetrative intercourse, not being able to have an orgasm, but also not being able to do any sport because of friction and rubbing. But women also get recurrent bladder infections because the microbiome changes in the bladder opening, but also within the vagina and the vulva as well. And this is can be potentially debilitating. If a woman who enjoys riding her bike can't go on her bike anymore, her Peloton, for example, the friction in the saddle stops her from doing that, or she can't go for a run anymore, or she can't put her gym gear on because it's so tight and it feels uncomfortable because she's also sweating because it's stinging and burning. I mean, how debilitating is that? And let me tell you, it does not go away without treatment. It will not go away without doing something. And we have a non-hormonal approach, for example, where we first of all avoid the things that make it all worse. So the one really key thing here is do not use any soap, any bubble bath additives, any detergents directly on your vulva or inside your vagina. There's no need. You're not dirty. Water and a flannel is absolutely fine. And a lot of these detergents, the bubble baths, dermatologists hate it because anything that's foaming strips your natural oil barrier off the surface. So you want to avoid anything that's foaming. You do not need soap. Soap is immensely alkaline, and the area we have in the vulva and vagina is meant to be acidic. So if you strip off the acid mantle, if you strip off that, what is meant to be a protective acid layer, you invite other bacteria and thrush, yeast infections to flourish and to cause problems. So don't use bubble bath. Don't use soap, use flannel and water, and you don't overwash. A lot of women wash too much almost because they think they smell. But if you do smell, see a doctor and have a swab, have it investigated. And that's the first thing that is very simple to do. You save money in the process as well. The second thing is you can use non-hormonal lubricants or moisturizers that are a bit like a face cream for the vagina, and you can use them during intercourse, the lubricants and the moisturizers whenever you have a dry feeling, but they are not having a long-lasting effect. They have a very temporary, short-lived effect on the surface, but the real treatments that are very much more beneficial and have a more long-lasting effect are topical vaginal estrogens that I mentioned earlier. So that's usually estradiol in the form of a pessary or a ring you insert, or that is estriol, another very weak estrogen that you can apply to the surface or inside and on the vulva directly. And you do that to start with, you give it a boost. You do this over 2 or 3 weeks in a row, every night, and then you go down to a maintenance dose. And what these products do, they will help to restore the natural skin barrier. So they will help lactobacilli to thrive, because they prefer to thrive. They need estrogen to thrive. Lactobacilli make lactic acid, which is what we want in that area. We want an acidic pH. But also it increases collagen, it makes everything plumper, it protects it from infection. So we now recommend in the UK that women who have recurrent bladder infections or UTIs, urinary tract infections, to go on a topical vaginal estrogen to prevent them, because there's very good evidence that, bladder infections or septicemia as a result of a kidney infection or urinary infection kills so many women. It's completely unnecessary, because if we use those products, which are extremely safe, we could prevent women from dying from, urosepsis, which is very common. And how many of your grandmothers do you know who've been to hospital with a bladder infection and confusion and septicemia and so on? So that's really, really important. And it's, in terms of breast cancer, there's no increased risk of breast cancer with these products. And they're incredibly safe. They're incredibly easy to use. If one thing doesn't work, move on to something else, a pessary or cream or gel, whatever works for you. Don't give up, and work with your doctor. If the dose you're on is starting to help but not quite enough, you can maybe go up a bit. You can use it more frequently. Even then, they're still very safe. And I think they very much enhance any woman's quality of life. I believe almost that that's one of the medical products that almost all women in their postmenopause years would benefit from, regardless of whether they're sexually active or not. Our genitourinary tract is not just a vessel for sexual pleasure, right? It's a really important organ. And someone will say, oh, I don't need this because I don't have sex. Well, yeah, you still benefit. It doesn't have anything to do with sex, but mostly women will notice for the first time when they have a new partner,
right,
that is a problem, and then they will say, this is so, I'm not going to do this. But why,
Yep. Absolutely. Yeah, it's and by the way, to clarify for those who may have not caught it, I know that there's a lot of people are very concerned about breast cancer risk and estrogen, and we won't dive deep into that. I actually have an episode coming out about that. But you're specifically speaking about vaginal estrogen.
Correct.
This is not about the oral and the patch. Okay. So before we go, just because we went so deep into the treatments here, I want to ask you one question, and then we'll get back to the skin and hair and nails that we see when we look in the mirror. So I was recently at a conference and I learned about one of these red light therapy wands that you insert into your vagina. Halle Berry is partnered with a company for her new company, which everyone is so excited about, including me. And I'm sure you are as well, because having celebrities talking about perimenopause and menopause is so huge, because I think it'll really speed up education. But nonetheless, I did want to ask what the research shows about such a wand. And so I think she specifically said she might have had dryness or tightness in her vagina, and she used this and it was wonderful. And I'm so glad that it worked for her. But I would just be curious what the data showed based on the research that you had done, just so as people make decisions around what to do. And obviously you just highlighted the strong benefits that all the urogynecologists I've spoken to about vaginal estrogen. So just for those who are curious and happen to hear about that product, I'd love to hear your thoughts.
So I haven't seen that specific product, but with regards to research, I'm not aware that there is very good research at the moment, or where we talk about good quality research with large trials that go on for many years, potentially with a large number of women. I would say I can't currently explain how such a gadget would work from a logical point of view. It may have a small benefit in the surface structure of the mucous membrane, but if I'm really honest, I'm very skeptical still about it, and I personally would not recommend it to my patients until we have more data. Because what I've got a toolbox as a doctor with very safe and very evidence-based treatments already. So we do not necessarily have to reinvent the wheel here. I know that there's lots of conditions and lots of health conditions where we desperately need new treatments, but this is not one of those areas. So we even have DHEA, which is a pessary what you can insert from a hormonal point of view. We've also got, we've had laser treatment for years, vaginal laser treatment, and you know what? These expensive machines that people, including doctors, got into their room, into their private spaces. I don't think they've hit it off. They're extremely expensive. And I personally know women who've had this done, and they said, I wish I hadn't spent £3,000 on something that didn't work. And the treatment, so in terms of, I think it's poor value for money at the moment, these laser treatments, for example. And I am very, very doubtful at the moment that any of these red light probes that you can buy hold up to the marketing promises that you hear. So, and I would like to see more research on this, and I would like to see more data on it before I recommend it to my patients. I'm going to watch this space. I'm always open-minded, and if anything changes, if they suddenly turn out to be the next best things in sliced bread, of course I will recommend them if they're safe and don't do any harm, and if they're affordable to all women, but not at the moment.
It's a very fair statement. And actually, like what you said about how there's already so many options, I almost want to map out, okay, guys, we have 1,000 of these already in all sorts of different ways, or we already have, wonderful treatments for this, but here are the huge gaps that are not served. Can we just all spend the money there on the research? If in my spare time, maybe I'll map that out. I'll keep you posted.
Going back to that, Georgie, what we also need is side-by-side trials. So we want to see a trial where we compare the red light probe or the wand versus the estrogen pessaries and the cream, and to see which one actually outperforms the other, or are they equally good, in terms of symptom control and the structure of the skin. And that is the important thing. There is a lot of bias in these early researches when a new product launches. So what is really important is to do placebo-controlled trials and also side-by-side trials, and they are expensive.
Exactly. Okay, so now let's get back to the skin that we look in the mirror that makes us self-conscious, because I'm glad we spent so much time on the vagina and vulva, because we do not talk about it enough. So I'm glad we went in depth, because people needed to hear that first, and then we're going to get to the part that we see in the mirror. So before we go there, you spoke so much about estrogen. Can you just give us a high-level overview, just so we can dive into some of the solutions on the roles of progesterone, cortisol, and my learning of vitamin D being a hormone more so than it is a vitamin? So can you just talk to us about these three at a high level? And then we can dive into some of these solutions.
So these are all steroid hormones. So these are made from cholesterol, which is the building block for all of these hormones: cortisol, the vitamin D, estrogen, progesterone. So cholesterol is the building block, and we make our own cholesterol. So it's not so much a cholesterol that we ingest, nutritional cholesterol, because it's from cholesterol that the liver makes. From the cholesterol molecule, we can make all sorts of goodies in the body, including cortisol, which is made mainly in the adrenal glands, but also vitamin D, which is mainly made in the skin after sunlight exposure, but we can also eat it or take it as a supplement. And then there's progesterone that we make predominantly in our ovaries after ovulation. So progesterone, we have very much less research about progesterone, to start off with that, and skin. But progesterone, so I'm not talking about the progestins that we have in the birth control pill. I'm talking about the natural progesterone that the female body makes. So progesterone is, the main role of progesterone is to prepare the womb for pregnancy after ovulation. And we only produce it after ovulation. When we stop ovulating, we produce very, very, very tiny amounts of progesterone. Progesterone is important because in its own right, it is an anti-androgenic hormone. So it stops the potentially negative side effects of testosterone in the skin. It stops an enzyme from converting the lovely testosterone that we like for our libido and our sex drive, but it stops that from being converted into dihydrotestosterone, which is potentially a molecule that can cause a lot of havoc in the scalp, causing female pattern baldness, but also hair growth around the face. And you might be familiar with polycystic ovary syndrome, where women have very high levels of testosterone, very high enzyme activity towards shifting testosterone towards dihydrotestosterone. So this is a problem. So they have facial hair growth, body hair growth in places where they don't want it, and they have thinning down the crown, the vortex. Now, Professor Cherin from Semcor, you are probably familiar with her. She's done research with supplementing, so giving micronized progesterone, the same hormone that we use, that we are able to make in our ovaries during our reproductive years, to women with polycystic ovary syndrome. And she found that it reduces hair growth in the face. It reduces the negative effects of their high levels of testosterone. So she found that to be very beneficial, for example. So we are only in very early stages of realizing how important potentially progesterone can be for our skin health. And I'm not saying that it will work for all women, because I'm very much aware there are some women who cannot take progesterone, who are progesterone sensitive, and who have mood side effects to that. But I believe that there is a lot of potential with this as well. And we know that topically applied progesterone, so 2% progesterone cream, for example, in one clinical trial showed an increase in collagen and moisture levels. So it has potentials also for topical application. But it's only really just been discovered in the last 10 years, because initially the synthetic progestins were on the forefront of what women would receive in medication. And we know that they are associated with an increased risk of breast cancer. They're still very useful, but the purpose for them was always to protect the lining of the womb from endometrial cancer. So that was always why they were specifically developed. And we only, until recently, we couldn't really give women micronized progesterone because it is very poorly absorbed. It's a very large molecule. And when you give it in its original state, it does not get absorbed. So we get around this now by micronizing it so that it gets really finely milled and then dispensed in an oily substance, because it's an oil-based, oil-soluble hormone. And so we take it in a capsule that is dispensed in some oil. That's how women would take it in the form of menopausal hormone therapy, for example. But going back to vitamin D is made also from cholesterol, also a fat-soluble vitamin. If you take vitamin D in a capsule, you probably see it's got fat in it, it's got some oil in it in a capsule. It's also in oily fish. Vitamin D is fish is rich in vitamin D, sardines, for example. But vitamin D declines as we age. And what the big problem that I found really shocking is that when we go out in the sun, we assume that at any age we make the same amount of vitamin D, and that's just not true. They did a very interesting clinical trial where they looked at 20 or 30-year-old people versus 70 or 60-year-old people. And they put them on the beach for 10 minutes. They measured their vitamin D before and after they've been in the sun. They didn't burn. That was a very safe exposure to sunlight. And they found that as we get older, our skin is less and less capable of making vitamin D. So we cannot always rely on sunlight for our vitamin D. So just, and we all have to be aware of, obviously, skin cancer as well, but some sunlight exposure is healthy. You don't need a lot, 10 minutes, depends on where you live on the planet, and depends on your skin color, depends on how much melanin you have. All of this plays a role, but age plays a role as well. So as we get older, even if we are in the sun, if you're 70 years old, you may not actually make that much vitamin D as you may not make as much as you think you are. So it's worth having your levels checked, because you also have, as a woman in particular, that skin bone connection, right? So you've got the risk of osteoporosis. And if you then also have low estrogen and you have low vitamin D, that is not a good combination. I always recommend, you know what, between October and April, you take your vitamin D supplement. In the summer, you get a little natural sunlight exposure, and you can also make vitamin D through sunscreen. Sunscreen does not stop you from making vitamin D. This is a myth. Going back to the third hormone, cortisol, also made from cholesterol down a chemical pathway in our adrenal gland, but we also make it in the skin. So we make cortisol in the skin itself. And when we're stressed, in the acute phases of stress, our brain signals, oh my God, she's stressed. We need to respond. We need to increase the blood pressure. We need to make her more alert. So it tells the adrenal glands, make cortisol, make adrenaline. We need that for her to cross the road safely. She's driving, she's stressed, or whatever. Anyway, then the cortisol from the adrenal glands also go to the skin. But the skin also responds to the signaling from the brain and makes cortisol in its own right. And in a chronically stressed person who has got a lot of high levels of cortisol and stress hormones in their body, we know that the skin is literally washed in cortisol. That temporarily the cortisol levels in the skin really increase. And that is to protect the skin to some extent. It's a fight and flight mechanism that is supposed to protect the skin in times of stress. But if that stress is ongoing, then cortisol can become harmful. And cortisol is secreted in our oil glands, in our sebum glands. In the face, we have a lot of oil glands in the face. Anyone who had acne knows how oily T-zones can get, right? So cortisol is excreted through that fat. And when that oil, the sebum from these glands. And when that sebum goes onto the skin, it also spreads all that cortisol as well with it. And initially, stress can make your skin better initially in the very early stages. And you think, okay, my skin, I've been really stressed, my skin looks good, all good. But then if it lasts, if the stress goes on, it does become damaging. It disrupts the skin barrier. Skin can become flaky, skin can become red, skin becomes sore, and then you look stressed. So chronic stress through cortisol, through stress hormones, either produced in your adrenal glands or produced directly in the skin, can reflect in your skin further down the line. Now, we're all different, and some people are tremendously beautiful with beautiful skin and they are stressed, but it never shows, and they're just lucky people. But I know for myself that when I am stressed, sort of when it's a bad type of stress, not exercise, which is also beneficial, that's good for the skin, but when you're chronically stressed, you look, it shows, right? I don't know. I think everyone knows what I'm talking about. Blotchy, red, itchy, disrupted skin barrier, sensitive to anything you put on, swollen, puffy, water retention, all of this.
Yep. No, that makes a lot of sense.
Yeah.
There's a few interesting things that we should just quickly summarize here. So one is the big question around estrogen, because I believe there's companies testing out whether or not estrogen ingredient as a cream, or maybe even people using their vaginal estrogen and kind of using a little extra on their face and hands. Can you tell us about the role of that and what the research is showing thus far?
So this is really fascinating, and we have research going back to the 80s. So you know what? We've researched it when we understood more about menopause and what it means and what the implications are. There was a pharmaceutical market, so companies created products for women to help them and to feel better, and we can use them. They started to produce the topical vaginal estrogen products to help with genitourinary symptoms of the menopause, as we discussed earlier. And then some dermatologists said, oh, look at that vulva. Look how the skin is more resilient, it's more elastic, it's more plump. The skin, the vulva is the same as the face. What works down below can also work in the face. Let's try and do a trial. And it worked, of course. You know, they did this from the 90s, and they started with small studies, and most studies that looked at topically applied mainly estriol, which is the weakest estrogen we have. So we have three types of estrogen: estrone, which is more prominent in postmenopause; estradiol, which is the one that we have in our reproductive years; and estriol, which is mainly during pregnancy, but it's a weaker estrogen. With weak, I mean it does not go to the endometrial lining a great deal. It doesn't treat hot flushes very well. It's not really used systemically to treat severe menopause related symptoms. So we have them in the form of a cream or gel or pessaries for the vaginal area, and we have research, long-standing research to show that topically applied estriol cream can increase moisture levels in the skin, elasticity, can restore the skin's pH, can help with wound healing. Estrogen has a tremendous role in wound healing. There was one study that looked at the forearm of participants, women, where they applied estriol cream to the forearm for several weeks, and then all these people went on to have surgery on their forearms, and then they compared the skin healing, wound healing rate in these participants, those who hadn't applied the estrogen, those who had applied the estrogen. And the people who had applied the estrogen to their forearm had a much a faster wound healing and fewer infections. Their estrogen may actually, or estriol may play a huge role going forward in people who have very thin, very fragile skin, maybe under a doctor's supervision. And we have companies, as you quite rightly said, who are now producing products that we can put on our face, estriol in particular, and they're using the research that's been done from the 80s, where they have shown, okay, if we put 0.3% estriol on in that amount on this skin surface, we do not see an endometrial cancer problem, for example. But the problem is we haven't really got that many studies that look at the side effects. We know it works, and there's no doubt it works. The problem is, why, if this is known since the 80s or before, we even had Premarin cream, which is conjugated in cream since the 70s, why hasn't a company launched a skincare cream yet containing estrogen, right? Why haven't they done it? Because we don't know. So the dose makes the poison here a little bit. So let's assume that a small amount, so that the amount that we currently use for the vagina is very standardized. Women get a tiny tube shipped, or they get a tiny tube from the doctor, and they use an applicator full. They have a device they can measure it out with. They use a certain amount twice a week, and we know that going forward that's going to work. And it's a definitive surface area. Now let's say women want to use it on the face, but also on their chest and maybe also on their arms. So the exposure, even at a low concentration, increases. So you may potentially have systemic absorption, whereas we know from topical applied estrogen on the vulva and vagina, we get very, very little, if no, systemic absorption. So you can't measure it in the bloodstream. That means it also can't do any problems. It can't go to the womb, it can't increase the womb lining, which could lead to endometrial cancer, which is the main concern when we use these products. So when we use them on the face, potentially women could put it under their eyes, but we haven't quite cracked how much is safe long term. How much does the facial skin absorb it in terms of the concentration, and how, if you use it every day, let's say, how frequently do we have to use facial estrogen products to see a benefit? Do we have to use it every day, or is it twice a week enough? And what if a woman says, oh, I can afford loads of tubes, I buy more than just a tiny tube, I want to put it on my entire body. So then we have potentially systemic absorption if you do this for many years. There is one infamous case publication that's been published in an over 90-year-old woman who has, I believe, over 50 years put Premarin cream, vaginal cream, on her entire body as a body lotion every day. And she died from endometrial cancer. And some people use this as an argument to say, look, if you do this, you get systemic absorption and you can get endometrial cancer. But hey ho, she was 95, I think, and she probably had amazing skin, But saying my bottom line is, what we are lacking is a product that is standardized, that we have given to women over, let's say, 5 years, every day, applied to the face, or a very definitive, defined skin surface area, measured the skin thickness, hydration, and the benefits, and so on, but also did blood tests and uterine pelvic scans to measure the thickness of their womb. And once we've got that, I would be the first person to use that cream, because I think it will work. It's super, right? It's gonna be a game changer potentially. But we have to be careful.
Absolutely.
And the problem is also, these products contain natural hormones. You can't patent them. So you can't patent water, you can't patent estradiol, because it's a naturally occurring substance. There's no incentive of a big pharmaceutical company to run a trial with 10,000 women over 5 years and make them have annual pelvic scans and make them have blood tests and show that it works, So no one's going to pay for that. And that's the problem. The companies that currently offer it are niche companies. They do this on prescription, under supervision of a doctor, and they're doing this based on old research that we know was potentially safe, but it's a bit of a gamble, really. It is, at the moment. And I think the best person for this treatment would be a woman who's already on menopause hormone therapy. So if you're already on systemic menopause hormone therapy, it probably, and I'm sticking my neck out here, makes no difference if you also apply a little bit of estriol to your face, because you're already having, I'm assuming, enough endometrial protection for estradiol, which is much, much more potent. So those women are probably all women who had surgical menopause, for example.
Yep. Okay, that makes sense. Good news. So then, what about for those who don't want to do this? There's still a lot of options. So obviously, like I'll just quickly summarize a few things that I remember. So in the book. So obviously, foundations of like eating healthy, you're drinking water,
Yes.
getting your sleep. I know we say, don't stress. That's, easier said than done. But I think foundations like sleep and food and stuff can help. So we can't always eliminate the stress that comes up in our life, but also really interesting tips like using Vaseline. I use CeraVe. I don't know if you have that in the UK.
Also has
Goodness,
also
that
has
is
liquid
amazing.
paraffin in it as a baseline, right? It's one of the baseline ingredients. Very good one.
Yep. Because I will admit, I have a cream that is supposed to be incredibly moisturizing, and I put CeraVe on top of it because it does not moisturize enough.
Absolutely, that's what you do.
Yep. And I probably won't purchase that cream again because I'm like, why am I doing that? This is crazy. So I'll do a skin test based on old pictures, and I'll compare not using that and only using CeraVe, and we'll see what happens. But these were like the Vaseline one, I will say scares me because I'm just traumatized from being a teenager. And I feel like Vaseline was bigger then. And for whatever reason, correct or incorrect, my brain associates clogged pores, Vaseline, terrible, don't ever use it.
No, there's no evidence.
Tell us the truth.
Yeah, okay. It doesn't clog pores. It's I know it feels greasy and it is counterintuitive to put something greasy on oily skin, right? But to be fair, if you have severe acne, you may not need an extra moisturizer. You may, of course, you can have mixed skin. You can have oily T-zone and really dry areas around the cheeks. And just put your Vaseline on selective skin areas. If you have that type of skin, don't put it in the oily areas where you don't really need moisturizing because your face is doing that job for you. But as we get older, the symptoms change. So you're more likely, women in particular, more likely, the main concern is not oily skin, but dry skin. There's even a skin term, formication, not fornication, that's something else. Formication, which is a specific...
Sorry, that's really funny.
The insiders will know. Don't look it up. No need. It's not that funny. But formication is a term for ant crawl, and a sensation describing ants crawling under your skin. Very debilitating. Anyone who's ever experienced it as a result of menopause will know what I'm talking about. And it keeps you up at night. It's a weird sensation under the skin, like having ants crawling under your skin. And that's very specific to menopause. We know that it's more common in menopausal women. Dry skin is more common. Skin barrier problems are more common. So one of the main tips I would also say is don't over cleanse. A lot of women think they need to have a 10-step cleansing regime. That's complete nonsense. Water in the morning is enough, and an oil-based cleanser if you've got dry skin, or a cleansing balm. CeraVe does really nice non-foaming, so lotion-based cleansers. So a gentle, either oil-based or sort of cleansing balm is perfectly enough. And then a flannel again. If you want to use a micellar water or something to take off the rest, or just get rid of the remnants of makeup to make sure their skin is clean, that's fine. But a lot of women do probably over cleanse, and you may do more damage by cleansing too often and using too many products and too many ingredients to clean the face with than if you weren't cleansing. But I'm a big fan to take your makeup off at night. It's important that you do that, to get rid of all the dirt and the makeup and the sunscreen overnight before you go to bed. And then you use whatever active products you want to use, whether you want to use a hyaluronic acid serum, whether you want to use tretinoin or retinol based products, or whether you want to use antioxidants on the skin, a serum based on antioxidants or peptides. Whatever you want to try, have a go, but then you leave that to sink in, and then you put your moisturizer on top. And if you want then to put as a last step just a little bit of Vaseline around the eye area, where you tend to wake up in the morning with creased skin. So some women have, in particular, the crow's feet or the dry area under their eyes or around the mouth. So that's where I would suggest you put a very thin layer of either CeraVe, a very nice, thick, rich moisturizer, or Vaseline. And Vaseline has been shown in many clinical trials to reduce transepidermal water loss. So at night, our skin loses particularly a lot of moisture. That's nothing to do with breathing. Our skin doesn't breathe, but it's obviously a barrier, but it also lets out moisture. And we want to trap that precious moisture in the skin while we sleep. And that's what Vaseline does. It doesn't do much else beyond that. It's not an active ingredient, but it does trap the moisture in the skin, and you put a thin film on the areas that you're particularly concerned about. If you don't want it on your forehead, don't put it on your forehead. If you don't want it around your nasolabial folds because they're generally greasy, don't put them on. Just put it under here or wherever you have the dry skin or where you're worried about. So in a thin layer, I'm not saying you need to shine, you need to be shiny and have a thick layer of that. But any rich moisturizer will do that. And it doesn't have to be expensive,
Yep.
but Vaseline is particularly
Yep.
affordable, and we can all carry a small pot of that around. And it's really a single ingredient product which has been filtered to a medical grade level. So there's really, as far as I'm aware, not a single reported case of an allergy to Vaseline. We can even put Vaseline on wounds. We can stop burn wounds from losing moisture by putting a layer of Vaseline on it. So it's been around for a long time. We mustn't be afraid of it. And if anyone says, but it's not natural, it's from petrochemicals. No, it's actually, it is very much natural. It's from the ancient trees from 5 million years ago, 5 or 10 million years ago. So it's very natural. It's just carbon. It's just a carbon based product. And whereas a lot of women think natural products are better, but we do know that certain aromatherapy oils can be very sensitizing, and
yes,
only because something is from nature does not necessarily mean your skin will tolerate it. And just, I think there's more harm has been done to our skin by using aromatherapy oils, either directly or in skincare products, than has been done with Vaseline.
Yep. Okay, that's fair. Wow. Well, this has been such a great conversation, and I'm clearly there's so much to discuss, and I highly recommend that people just get your book and put it on their shelf, because you talk about skin and hair, which we didn't get to, but a lot of the hormones and stuff that we discussed today clearly have an impact on so many aspects. But again, you discuss so many different solutions that people should take into account and try to see what works for them. And I really appreciate that you write in here, like what the studies say, what we still need to research, what your verdict is, because sometimes the studies aren't huge ones. And so it's like, well, what do we do then? So this was a great conversation here to hopefully give people an idea of some of the things that they should be considering as their body enters this stage of life. And hope that we can also continue to help people understand this is not doom and gloom. Perimenopause and menopause, it's a normal stage of life, and there's wonderful things we can do to maintain the awesome things we were able to do before we aged.
Yeah. And don't feel like you're going to a shop. Let's say you have found a really great moisturizer that has served you very well over many years, and your skin responds really well to it still. And let's say you find yourself in a beauty shop, in a skincare shop, and you see that shelf that is designed for you, for your age group, for your symptoms, and it makes you feel like you need to buy that, and whatever you're using is not good enough. Think twice. Because, as you said at the very beginning, if you look at the ingredients, if you go home and compare side by side your trusted moisturizer with a new menopause cream, you will find they're probably the same, but you've just been paying, how much more for this cream, while actually you could have carried on using what you've already got. So, I mean, do decide to part very wisely with your money for the right reasons. And if you have found a good cream, and yes, sometimes we have to try loads of different products, but if you find a good cream, just stick with it, and it doesn't have to cost the earth. Sometimes the cheaper products do exactly the same job, and sometimes even better than the most expensive ones.
Absolutely. But I still think we as women love sometimes buying like one or two things that are not $5. It's just a thing. Here, at least we have information so that we can make informed decisions when we are like, well, we don't have as much money right now. So which thing are we going to give up? So now we know.
Also, of course, I do not enjoy opening a plastic tub or a metal tin of Vaseline as much as I enjoy opening a beautiful, very thoughtful, packaged, nicely smelling skin moisturizer that I put on and I smell it and I think I'm doing self-care, you know. You know what? This is part
Right?
of it. It's an emotional connection to yourself
It
and the
is.
skin. And of course, Vaseline is just one thing you can use it as well. But you don't need to strip it back to just Vaseline. You know, that's not what I'm saying. If you have found something that you really enjoy using, then please do so if you can afford it and if it's doing the job.
Absolutely.
But I do like the sensory experience. And yes, I do spend money on things and I do try new things out, but I also feel sometimes slightly annoyed when I'm disappointed because something didn't work, really blatantly didn't work. So that annoys me.
I agree. Well, now we have the data. So thank you so much. Thank you for writing this book. And, uh, I'm really happy that you came back on and look forward to sharing this with the
Thank
Fempower
you,
Health
Georgie.
audience.